Capsule endoscopy was invented around 2001. So approximately 10 years ago, people in Japan started working on so-called double balloon enteroscope. So that was introduced around 2003. So after that, another development was invention of single balloon enteroscopy, using a balloon with an overtube on top of an endoscope. So I would say it's been out for the last few years. University Medical Center is the first hospital in El Paso to acquire this modality. All right, so this is a long, flexible endoscope that can go deep into the small bowel. Attached to the endoscope is an overtube that has a balloon on it. Inflate. So by a series of maneuvers where you push the overtube forward, inflate the balloon, and pull the endoscope and the tube back, you reduce loops in the small bowel, and then you deflate the balloon, advance the scope forward, advance the overtube forward, and do this series of maneuvers over and over. So the balloon is basically acting like a fulcrum, and you can pleat the small bowel and just keep pulling it forward. So it's a way to move forward. Where's the balloon now? In the small bowel. So we look deep into the small bowel in this patient with iron deficiency anemia, possibly abnormal capsule endoscopy, but our exam was normal. Needle out, and then just inject a little bit. Injecting. We did a tattoo at the furthest most point that we went, and now if we have to go back from the other end, we'll know how far down we went. All right, now I'm going to take everything out. Now it enables us to do therapeutic procedures and not just diagnostic procedures on the small bowel, and therefore improved investigation of certain syndromes such as iron deficiency anemia, obscure gastrointestinal bleeding. It should lead to less number of additional procedures the patient needs in order to make the diagnosis, as well as improved treatment of patients with small bowel lesions, and in many cases removing the need for surgery, because these problems might be treated endoscopically and the patient wouldn't have to go to surgery to treat the problem. So we're really expecting, it's good for the entire city, because patients with obscure gastrointestinal bleeding and other small bowel problems who would otherwise either keep undergoing repeated investigations or have to go to another city to a specialized center that might have this type of endoscope, now it's available in El Paso.